I'm Dr. Allan Perel, and this is Conversations in Medicine. This program brings cutting-edge medical topics to the Staten Island community. Today's program is dedicated to the 25th anniversary of the MS Center of Staten Island. We'll discuss multiple sclerosis from a patient's perspective. Just for a little bit of background, multiple sclerosis is a neuroimmunological disorder. What makes it so unique is that the body actually attacks itself, and attacks a part of the brain and the spinal cord called the myelin, which is the covering of the brain. The myelin is essential for signals to get from one nerve cell to the other. MS affects both the brain and the spinal cord. Since everyone's brain and spinal cord are different, everyone's form of MS is always different. Some will describe blurred vision because of inflammation of the eye nerves or inflammation of the eye nerve, leg weakness because of spinal cord problems, balance problems, dizziness, double vision because of problems with the back of the brain called the brainstem or the cerebellum. MS has been recognized for over 150 years. Until 1993, we had no effective treatments for MS, things that we call the disease-modifying therapies. We now have 13 different treatments that affect the course of MS. We are in the midst of a tremendous amount of research and education with discoveries about MS. Our new treatments have changed the prognosis of people with MS. Before disease-modifying therapies, if you were diagnosed with MS, you'd have a 1 in 2 chance of needing a cane in 15 years. Now it's about 1 in 10. We've really come a long way. This year marks the 25th anniversary of the MS Center of Staten Island. New cutting-edge improvements in treatment have taken place, including medicines that help people walk better, disease-modifying therapies, and therapies for symptom management. There are over 500,000 people in the United States with MS and over 2 million people in the world. MS affects women about 3 times more commonly than men. It also affects people usually starting between the age of 15 and 50. At this time, we still don't have a cure. As I tell people and when I give lectures around the country, how many medicines do we need? We need 500,000 medicines. Every one is different. What we really need is one medicine, which is a cure. So it's my pleasure this evening to introduce my guest for tonight's program. The program is dedicated to both the patients and families with people with MS. So I'd like to introduce Patty Chapman. It's a pleasure to see you here.
Hi, Dr. Perel.
Gil Reyes.
How you doing, Doc?
And Jill Kay.
Hello.
And Jill has done a tremendous amount of work as a motivational speaker for people with MS. And I really say it's my privilege and honor to have you all here today.
Thank you. Thank you.
I'm going to start with you, Gil.
Yes, sir.
Staten Island's an interesting place, and we have such a wonderful local community. You founded, or one of the co-founders, with a group called SIMS. Tell us a little bit about what SIMS is.
Actually, SIMS is a group of people that get together. We do it like maybe once a week, and basically we talk about different topics of how we feel and what we do every day.
See, what I think, not to cut you off, but to talk about Staten Island MS,
Yeah.
SIMS, what a marvelous group that you guys get together so often
Right.
and basically support each other.
Yes, we do.
If someone's having problems, you have so many luncheons and dinners and events and fundraisers and things to make people.
And that's the
feel
whole
better.
thing. The whole thing is just to talk to each other and make everybody feel a little better, you know, because everybody feels completely different at different times, you know? And you see it. And not two people are alike when they have MS. Everybody's different, you know. But it's we try.
And that's marvelous. And support groups are just so important for people with MS or any chronic process problem. Right. It's nice to be able to talk to people, to be able to see people.
Yes.
We're going to sort of talk a little bit about MS. And when I was growing up, before I went to medical school, everybody would think of MS as something that Jerry Lewis would take care of on the Labor Day telephone.
Right.
That's actually muscular dystrophy,
but
it's a totally different disorder. This is a disorder of the brain and spinal cord.
Right.
And it usually affects people not as young as muscular dystrophy, which is really a pure muscle disease, which MS is not. So Jill, let me ask you, when you were first initially diagnosed with having MS, or just how you got to that process, many people in the community, a lot of people when they come to my office or just any neurologist, they're always worried that they have MS. Right. There's a tremendous concern, especially a young woman feels some numbness or some tingling or has some issues medically or neurologically. And that's always one of the first things, especially if you go on WebMD, it pops up so quickly.
Right.
Tell us a little bit about your personal experience of how a diagnosis was made and where we came from there.
So I was at a baseball game with my family, and I had gotten a phone call. So I climbed over the seat to speak privately, and when I came back down, I put my head down like this, and I felt an electric current run through my body. It was a crazy feeling and something I never felt before, so I kept doing it, which sent this current basically from the base of my neck all the way down my spine. So the next day I woke up and my feet were sleeping and I couldn't wake them up. So I went to my primary care physician, who told me that I possibly pulled a muscle from climbing over the seat in my back, to give her a call if I didn't feel better in a couple of days to take a muscle relaxer. Well, a couple of days later, I did not feel better. I had bed spins, blurred vision. My hands fell asleep with those pins and needles that when you shake it, you just can't wake them up. I had that hug, that MS hug in my midsection. I lost all my peripheral vision. Some things would come back, some things would get worse, and I didn't know what to do.
So not something very subtle was happening.
Correct. So within I guess it was 3 weeks, every day something new was coming or going. So at that point, me and my doctor knew something was going on. He told me to see a neurologist. So I went to a neurologist by my house, who put me in the MRI machine for 3 hours. And after that, he called me in his office and he said to me, you have brain cancer. So I was devastated. I was young. I had 3 little babies at home. And I had to figure out how I was going home and telling my parents that I was dying, because to me, brain cancer was a death sentence. So I went home trying to get a grip on my life and got a phone call back from the doctor saying, I made a mistake, come back in. So I went back into his office and he said, I'm sorry, I did make a mistake, but you have spinal cord cancer, which again is a death sentence. So I tried to get a grip and I didn't feel good, and I was fortunate that my mom lived next door to a woman whose son-in-law is a neurologist, and he was willing to see me, which is you. And so I went into Staten Island with my medical records, and when I sat down, I will never forget the words that saved my life after reading my MRI and hearing about my symptoms coming and going. He said, the good news is you have MS, and the bad news is you have MS. And honestly, once I got a diagnosis and knew that I wasn't going to die from it, it wasn't so bad to hear that I have MS.
And as you said, we're dealing with a treatable disorder.
Mm-hmm.
In days beyond, in the past, it wasn't a treatable disorder. People would go on and get much worse. Now with our disease-modifying therapies, we have a tremendous amount that we could do. It's still difficult sometimes to make the diagnosis, even with MRIs, with clinical exams, but you really have to be attuned to it. And when I talk to my residents or doctors at the hospital on a daily basis, I always say don't take for granted, or don't say that it's stress that's causing it. So often a young woman will come in with tingling, numbness, and your symptoms are more severe, and say, well, you're just anxious, you're tired, your family's putting pressure on you, your job, all these other things.
Right.
Always take complaints seriously, because nobody wants to go to the doctor's office. There's a lot better things you could do during your day, and it's so marvelous to see all you guys here. So Patty, let me ask you about some of the family issues with MS. In a sense, when you go home, initially after the diagnosis, how do you tell people that you have MS, or do you tell people?
I actually didn't tell. I only had, when I was diagnosed 35 years ago, my children were 3 and 4. And of course, I never told my children. And I actually had another child when I was, I had already been diagnosed with MS. And she found out through her friend. And she was maybe 10 years old and said, Ma, my friend's mom has MS. Do you have it? I said, yeah, And she wanted to learn about it. She was one of those children that read up about it, And then I told my older children that I had it. I never wanted it to stop me or, hold me back. Not that I was special or anything, I just didn't want to do it. And like Dr. Perel said, there was no medication for us until '93, which I went on the syringe or the needle or whatever. And since 1993, I've been on many medications with the help of Dr. Perel, who's very knowledgeable. Like you say, that's hard to diagnose it, but a person like Dr. Perel is, you are attuned to what's going on with us.
Thank you.
And you don't give that you don't throw it at us and say, you have MS and go ahead, go home and take care of it. You work with us, and that's what we need. We need somebody to help us, to work with us and give us hope. And my children give me hope every day because they realize that I'm not going to just say, Mommy's got MS and I'm not going to do anything. I can't do it.
Right.
35 years, I have 3 children, 3 grandchildren, I'm still married. And, without the help of a great neurologist and all this medication that's keeping us the way we are. Well, I know I'm hoping for a cure, we're all hoping for a cure, but if you can keep us at this point, I think we're happy. And the children and our family and our parents and our sisters and brothers, I don't think we'd make it without them being at our side and pushing us. Not feeling bad for me, but again, just do it. You have to do it. We can't just sit back and do nothing.
Thank you for those kind words. And there's so many neurologists who've become so more attuned to MS, both locally and all over the country, that things have changed over the years.
Right.
So thank you. Gil, tell me a little about family with you. I mean, I know your family very well.
Yes,
You
you
got
do.
some of the
Don't mind.
nicest people, lovely daughters. Tell us, I mean, how did you describe MS to them and your caring wife?
When
Tell me a
I
little bit.
first got diagnosed, okay, it was a crazy thing. I'm coming home from leaving one place and going to the other, pulled over because my cell phone answered. I spoke to my wife and I told her, Patty, I got diagnosed. The doctor said I have MS. What the hell is that? I swear, and that's what I told her. I said, what is that? She says, don't worry about it. When you get back to the house, I'll have all the information for you. And that was it, because I went to the house and gave me the information that she told me, and I was like in shock. In shock. Well, the funny thing about it, she's telling me stuff, and I'm sitting in the doctor's office, looking at his plaques, and just seeing what his professions are in this and that and the other thing, I'm saying, wow, man, it's unreal, But never. I told I have 3 daughters, 3 beautiful daughters. I told my 2 oldest daughters. My younger one was only, I guess she was 3 years old at the time. And as she grew up, I told her, I explained to her, and they finally they all knew it, that I had it. I had MS, and I explained to them, they were asking the same questions. What is MS, And they looked into it. They read, they do their own little research and this and that. But it was, I'll tell you one thing. Without the family,
Absolutely. And it's still, you talk about learning, we all are still learning about MS.
absolutely, yes.
Patients are learning, I'm learning. Every
Yeah,
day
yeah.
we learn new things. And that's so touching. I mean, without family support, you can't get through this. I mean, that's why it takes a village
Absolutely,
to raise a
yes,
child.
yes.
It takes a village to help someone with any chronic medical ailment. You really need a lot of people. You can't do it by
do.
yourself.
Without a doubt.
If you do it by yourself, that's where we get into trouble.
And getting back to that support group that we have, that group, if we don't have that group, we feel lost. Because a lot of people, like I'm probably one of the guys that's had one of the longest. They always look over to ask me a question, which is good, which I appreciate it. Can I answer it? Maybe not. Maybe what? But I try to guide them. And we meet people all the time.
And I can't emphasize enough the support group. I mean, the group that you have some of the nicest, brightest people I know.
Yes.
And I'll tell you a story from someone in your support group, that they used to work at a very prominent private school on Staten Island. And she was diagnosed in, I think, the 1970s or 80s with having MS.
Okay.
And she needed a cane. And they wouldn't let her be in the school.
That's
They
right.
wouldn't let her be a teacher.
Yeah.
And really how much further we've come is huge. And if you don't have support groups, you don't know that if someone does something
No,
to you that's
no.
not appropriate.
Right.
Tells you can't do this work, you can't do that work.
Right.
How would you know? And that's where the National MS Society, all the other branches that we have,
absolutely, yes.
they have attorneys. I mean, Patty, we're telling you about trips and things that they go on for education, all so important. Let's go back to a few other things. So, Jill, when you look at your experience with the medical community, things like having doctor's offices with stairs and being able to get to certain places.
Right.
Have you guys, and I'll start with you, Jill, any issues that you've seen with regard to accessibility? I mean, having offices more accessible, not having stairs, and I don't know how they get away with it in certain places in Manhattan, Brooklyn, where you have to walk up 5 or 6 or
Right,
10
right.
stairs if you have MS or any other medical problem. So anything that you could add with regard to the medical community? Have they accommodated situations that you all might have had?
You know, I'm fortunate that I don't have a mobility problem, but I will say that there are certain things, even the mall that has the push buttons to open the doors automatically is helpful, and more places should do that, because if you do have some kind of disability, you can't exactly pull the door open and walk through yourself all the time. So that is something that I think people still need to work on.
Guys, anything that you've been noticing over the years?
No, I agree with her. Like when you go to, not my neurologist, I go to my gynecologist or my dentist. I have a dentist that had steps going downstairs, and they don't realize, because you're going to a dentist, you know, but there are people with problems. You can't, to me, when I see steps, I get standish, you know, I don't want to go, yeah, it has steps on it. I'll try to go around it. And with other doctors, I'm sure other doctors should feel the same way. Like, and I'm sure we're the only people, we have MS, but there are people, like you said, with other disabilities.
Right.
Correct.
And something like the push button for the doors is very helpful to me.
Good thing, yes.
You know, or elevators in certain places, you know, going into an elevator. I mean, I love to go shopping and go walking through the malls and stuff, you know, it's relaxing. And sometimes, you know, like you don't want to have your canes, you don't want to have your push cart, you know, even going ShopRite with your wagons is good, you know.
Right.
Like, my cousin had once told me, you're going to see like all the stores that have the wagons, you're going to shop there more often. And I was like,
Of course.
I just thought that was strange, but now I know, besides having MS,
Big
I'm
plus,
older,
big plus,
yeah. Having a wagon, putting your pocketbook in it and putting the things in it. And most people go to grocery stores, the men or the people will help you with your groceries and stuff, which is, you know, you don't want to ask people, but I know a lot of people just offer, which is even better. You know, I'm not one of those people that wants to ask for help.
Right.
I want to be able to do it. And I'm sure everybody wants to be able to do it themselves, but it's good. You know, like more people maybe should, you know, should pay attention to handicapped people, even though we're not as handicapped as certain people. You know, like the handicapped spots in front of the grocery stores, they're actually, they're good.
They
You
are.
know, they're less
They are.
walking, you know, carrying stuff, you know. and-
Absolutely.
Let's talk about the workforce now. Not everybody with MS works, and about 60% of people with MS at any time aren't working. And the reason a lot of people with MS aren't working is not really because of the walking issues. Fatigue is a very common symptom of MS,
Absolutely.
and it's about 95% of people will describe an overwhelming fatigue. And it's not being depressed, it's not because you can't walk, there's a certain brain chemistry that causes fatigue. Also, people with MS can have some cognitive issues. So those are the two major reasons why most people aren't working. For when you were working and now, tell me a little bit about how the world has set up for you guys to work or be able to function.
I mean, I work as a paraprofessional. I work with handicapped kids. So I do meet with my director of special services, and sometimes I do question a student that I may or may not be getting based upon me being concerned about my physical needs. So this way I don't harm a child if they need extra help lifting. If I'm not feeling 100% that day, nobody has to know that I'm not feeling 100%. But the fatigue is something that's kind of hard, because I can't exactly turn around and say at 12 o'clock I'm tired and I need to rest. So I figure out certain things myself to do to cope with that. But I work in a profession that I think it's a little easier for me.
Could you tell me the story that you told me outside before we came in about the young man that you're working with?
Yeah, so this year I'm very fortunate. I work with a 6th grader who happens to have muscular dystrophy. And when I questioned why you would put me with a student who has MD, my director said, "You'll see. I think you'll be perfect with him." And about a week into school, I realized my student's schedule was a little challenging to walk from one end of the school to the other. So we go to Spanish class, which is at one end of the building, and we have to walk to gym at the other end, and it takes a long time to get there. And the principal turned around and said, "Well, it's taking him so long, maybe he needs to be put in the wheelchair." And I looked at him and I said, "No way. If he could walk, he is going to walk. I am not going to tell him he can't or he shouldn't. I'm going to be his cheerleader and be like, you can, you will." And that's when it hit me that that's why I was placed with this student. Because if I can, I will. And
And-
I think that's important.
And that's so beautiful. I mean, the word can't really shouldn't be in any, shouldn't be in our vocabulary.
It's a big plus.
You know,
Right.
maybe we don't do it right now, it's
Right,
our
right,
choice,
right.
but the word
Right.
can't really can't be there, or shouldn't be there. So tell us, Patty, again, you've always had such a positive attitude, and when I give talks to patient groups, to doctor groups, you always know all the answers. So I know you do a lot of studying and keep up
Well,
to
I
date.
listen to people, and like I said, a lot of people being in the workforce. I was out of the workforce when I was diagnosed with, so I had part-time jobs, and I actually was working as a cashier, and having MS and a cashier, there was nothing to it. You have MS, but I had the numbness in my fingers, so I couldn't count the money, which was strange. Like I'd pick up the money, I couldn't feel
Right.
the change or the dollar bills in my hand. So it sounds strange, but that was my handicap, not being able to count money because of the numbness in my fingers and stuff. Beside the tiredness, but my boss would always give me a chair. Like I'd always have the chair by the cash register. I was the older person in the store, so Patty got to do this or whatever. But I remember trying to feel the money was hard. So everybody has their different challenges or whatever. But
You mentioned something before, and I'm just going to just touch on it. You had MS and you were pregnant. You had a baby.
right,
Years and years ago, there was a whole, in my medical community, said that people with MS shouldn't have kids.
yes, I was told that.
That was absolutely wrong.
Right, without a doubt. My daughter was, I had her in 1990, so I already had MS for, like almost 10 years.
Okay.
And my doctor was like, he recommended I didn't have the baby,
Okay.
but I wanted it. And he said the harder part was going to be after I had the baby,
Okay.
because you'd be more exhausted. And
Sure.
when you're tired, this and that.
Right.
And I had a baby that slept 23 hours for like the first 3 weeks. So
That's
God
great,
said,
man.
you know
That's
what?
great, right?
Right, it
Very
was good. And I'm glad I did it.
And just to talk about the science, whether you have 5 kids in the next 10 years or 10 kids or no kids, your MS won't be any different.
That's right, it was the same.
I mean,
And
we
I
know-
think mine is the same.
There are bumps in the road. When you're pregnant,
Oh.
actually you have more bumps in the road. Because as
Right.
we said, MS is an immune disorder.
Right.
And what's interesting about immunological disorders is during pregnancy, people do better. Same way a mother doesn't attack the baby, which has different blood, different
Correct.
hair, different skin.
Correct.
After you deliver, sometimes there's a little bit of a higher risk of having an attack, but we do have treatments for that. So again, we don't encourage people not to have children.
Right, and plus there was no I wasn't on any kind of medication
Okay.
because there was none around, so I didn't have to worry about being weaned off the medicine and going
right.
back on the medicine. I wasn't on medicine. Now I know a lot of medications, they don't want us to be pregnant on the medication because they're
Right.
not positive what would happen.
When
But
I
there's-
see you guys, I see such positive spirits. And is there any way that I could have you convey to the community, like what your outlook is? Not how you have it, but really how your outlook is. How do you have a positive spirit? And it's a hard thing. People are different. I mean, I have a number of patients with MS, doctors have people who, when we say it, they're reeling and they go for multiple opinions and there's just no answer. And they never come to grip with that diagnosis. I mean, you guys have all done that. And whether it's MS or not, we're talking to the whole community here. Whether you have a diagnosis of heart disease, diabetes, high blood pressure, anything you could think of. How do you come to grip
Well,
with
I come
that?
to grips I've had the disease, like I said, for 35 years. I do my medications. I try to watch my diet, what I eat, to eat healthy, let's put it that way. And you know what? My outlook is, this is it.
Right.
I got to keep going. And I speak to many people. I know
Absolutely,
many
yes.
people that have MS, younger and older, and I relate to them, especially the younger people. Like, look at me, I've had it for 35 years, and I've had children, I'm doing this. I have my
Right.
bumps in the road. We all have we want to
Everybody
sit
has
down.
bumps in the road.
Right, any disease.
So, yeah.
But we have to keep on going forward. As long as we have, and I know, Dr. Perel, you don't want to hear it, but as long as we have the best neurologists and the person that treats us like people,
Right.
you don't look down on us, and you have the outlook. You're giving me a better outlook because you're positive.
And that's
This
what
med-
all the teams do. I mean,
Right, this
a lot of the
medicine is gonna
doctors, that's why
work.
we have a whole center and
Absolutely.
team
Right.
with it.
Yes.
So let's talk about holistic portions. I'll talk about the medical side for 2 seconds. Everybody wants to know what to do with, say, something like MS. And really, the 3 things that you could tell someone there's no vitamin that's a magic pill,
Right.
except for vitamin D.
Right.
Right.
Vitamin D does help people with MS. That's one thing we tell people. 2 is a low salt diet. Makes your immune system less hyperactive, which we see in MS. And the third thing is not to smoke. And it has nothing to do with your heart, your lungs, anything like that.
Right.
Smoking actually makes MS worse.
Correct.
So when you talk about holistic approaches to MS, in addition to medicine, and I'll talk to you, there were some very famous people on TV, Montel Williams specifically, very bright man, and I've met him. He's on standard therapy in addition to all his health regimens.
That's right.
So that's what's so important. But that holistic approach is vitamin D, not smoking, and low salt diets, and of course keeping physically active. Let's go, we have a few minutes left. Tell me about family. I mean, Jill, I know Patty was talking about her family. Tell me about your family. And actually, your family's in the audience today.
Yes, they are.
So,
Yes, they are.
So tell me about their input, how they help, and how you help them, and what, in a sense, what the relationship is in order to get through some trying times.
Well, first of all, I have to say that I get up every day and I have 3 children and a husband, and I wake up with a positive attitude because of them. And so if I'm not feeling great, they're there to support me. And just like if they're not feeling good, whatever they have, I'm there to support them, and we persevere.
Gil, you mentioned your
I'm gonna-
wonderful family.
I'm going to agree with her also. You know, just waking up in the morning, depending how you feel, and just seeing not that I see my family every day because 2 of them are married, and then only my small one is living at home. But just to see how, you know, they just to talk to them.
Mm-hmm.
Talk to them, and they always ask you a question. You know, hey, Dad, how do you feel today? How's everything? Especially my wife. My wife is like the number 1. And I feel good about everything. I really do. It's like, getting back to the support group. My support group is my family. That's basically it, you know. And Mom and whoever, my sisters, my brothers, not that they live nearby, but you know, they'll always call me up. And these days of the holidays are very important too, you know.
Absolutely.
You know.
Guys, I want to thank you all for being here. It was so marvelous. To talk on the medical side, I was going to ask you how optimistic you were, but it comes across in the half hour we've been here. I'm optimistic too. Every year, every day, there's new treatments,
Yes.
things that are coming out, more effective therapies, different therapies, better therapies. And really, we've come such a long way in the 25 years that our MS Center has been around. And because of people like you, it makes me every morning get up and be happy to go to work and see people with a smiling face like you guys. So
Thank you.
hopefully we're getting close to a cure.
Hopefully.
Okay, Doctor.